Baby, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Patient-centered care is about treating a person receiving health care with dignity and respect, and involving them in all decisions about their health. This type of care is also called person-centered care. It is an approach that is linked to a person's healthcare rights. When healthcare professionals and services give you patient-centered care, it puts you at the center of your healthcare by treating you with dignity, respect and cooperation, compassion, communicating and coordinating your care between appointments and different services over time, such as when making a referral from your general practitioner to a specialist, or sharing your care between a community health service and a hospital, tailoring the care to suit your needs and what you want to achieve. Supporting you to understand and learn about your health, helping you find ways to get better, look after yourself and stay independent, involving you in your healthcare decisions at all times. Patient-centered care is more than just how your healthcare professional treats you. It is also about how healthcare services and governments create and support policies to put healthcare users, non-healthcare organizations at the center of care. How are patient-centric health facilities maintained? Today on your regular health TV talk show, The Physicians, we'll be discussing how to maintain patient-centric health facility. Stay tuned. It's another day with The Physicians, where your health is our business and will always be our business. My name is Dr. Martina Aigbe, your regular anchor on this program. Today we'll be discussing how to maintain patient-centric health facility. Patient-centric, that word look big, right? Don't worry, in the course of this program, you get to hear more about patient-centric health facility. And with me to discuss this is a very beautiful, elegant Dr. Chibuki Aigbe. She is the practice manager, One Wellness Center. You're welcome to the program.
Thank you. It's an honor to be here.
We've been looking forward to having you on this program. Finally, we got you here.
I'm glad I'm here.
So thank God you are here on The Physicians, because on this program, health is what we discuss, and the health of our patients is always our priority. What they need to know and how they can actually go about it. Apart from that, how about the facility managers? How are they able to cope with it? So at least you are here now to come and tell us what we need to know more about patient-centric health facility. So how do you actually define a patient-centric approach? Okay, how do you define a patient-centric approach in healthcare management?
So you pretty much gave a summary, a very good summary in your introductory opening or in your introduction. And what we see is that first and foremost, we need to know why you need to have a patient-centric healthcare facility or offer patient-centric healthcare. You know that the biggest part, or one of the biggest part of managing a patient or treating a patient, is the psychology behind, getting that patient better, being able to make the patient feel part of the patient's treatment. So from the first time you're seeing your patient or your customer till when you're done seeing treating the patient, or whatever outcome you and the patient have decided to achieve is met, the patient needs to feel involved in every decision, involved in the communication, them understanding what is being done, their opinions being sought, and their opinions being taken into consideration when offering care. So that's pretty much patient-centric healthcare.
Okay, so I think it's actually a very good one, because when patients are involved in the treatment, in the management, the outcome is usually better. because you tend to explain to them what the situation is and what is expected, the role they're expected to play. It's not only about the doctors and it's not only about the patients. It's actually is a two-way thing. So what strategy would you actually implement to ensure a patient-centric environment in a health facility?
First is collating data. So many times you don't know what we are missing until you experience it, right? So how many people actually know what's being involved in their own care means? How many people do know that it exists? So first and foremost, you need to let people, your customers, your patients, know that this is the kind of care that you're expected to see, and that way they even look forward to coming to really understand and experience what patient-centered care is. Also, you would need to do a lot of training and retraining of your staff, making them know that empathy is the language. So from the gate to your reception to even the doctors, the whole clinical team, the ad hoc staff, everybody can understand that the patient is the only. In fact, each patient should feel like the only patient. Each patient should come into your clinic thinking that you open shop for them that day, even if you're seeing 1,000 patients. Meaning that you should know each patient by name, right? Because that improves their. Remember, there was a campaign that Coca-Cola made. Had one. That should be about 2010, 11 thereabout, and then they had names on the can. I'm sure that was their most profitable campaign.
I remember
it made them feel. It made customers feel like, oh, Coca-Cola knows me. And everybody, felt, known, felt like I felt unique. So it's important, and that even happened, when I went to one school that my kids were in. From the gate man knows my child's name. So I feel that, it is because of me that this school was open, and that's really not the case. But it makes you feel at home in the facility that you're receiving care. And like I mentioned, you have to foster a culture of empathy, a culture of listening. So you can listen and you can actively listen. So listening both ways. So you need to be able to encourage your patients, know that you have an open door policy so that they give you feedback. You also need to be able to train your staff to actively listen without interrupting when patients are speaking, trying to lay complaints or give feedback to whatever concerns that they share. Also, making patients know that even the feedback that they give is being worked on. Those are very important strategies one can.
Because some organization will put a feedback box and they won't even open it.
It just
for the sake of it. So now that you have talked about the communication, the healthcare provider needs to listen properly to the patient. That has to do with communication, right?
Yes.
So how do you ensure effective communication between the healthcare provider and the patient?
So first and foremost, you want to be able to speak in simple terms. Okay, you can't say a patient and be saying the oropharyngeal airway is blocked and so we need to do this. Your patient is also going to look at you. So you need to be able to break it down and say your airway is blocked, so we need to do this and do this and do that. You can't give a patient. I mean, even for medical school, clinical training, they ask you, when they're asking you what is your presenting complaint, and you're expecting to hear layman terms, and then you cannot relate it in your clinical terms.
Exactly.
You can't say, do you have dyspnea?
Impossible.
Exactly. You want to say, do you have difficulty in breathing? You don't say, do you have anorexia? So you want to be able to make the patient feel comfortable to express themselves. They didn't come to your clinic for lectures or to come and join you in answering doctor. They want to actually feel like that they can communicate with you, so they can speak to you in terms that they can understand, and vice versa. Communication, a huge part of communication is even understanding cultural differences, religious differences, right? So patient-centric care, if a patient who is a Muslim, and if a woman comes in here and she's fully covered, you don't expect her to start taking off her clothes because you want to do an examination as a male doctor. So first the patient must feel heard, understood, and you can ask. So some of them can make that decision, but you need to be able to ask. And I, as a male doctor, do an examination for you, even with or without of course with a chaperone, but you must let the patient know, if you do not want me a male doctor, I can get a female doctor to come do that. That patient already feels heard. right?
Yeah.
You want to be able to understand cultural differences. If a patient, some patients want you to answer them, yes, ma, because they're older than you.
Yeah.
So you must understand that if you address your patients by their first name, and the patient, for example, is Yoruba, because in the Yoruba culture, they want to be answered ma, sir. Even if I marry a Yoruba man and his younger brother's wife is older than me, I must say, mommy this, auntie that. I'm never gonna have to address her by her first name. So those are very important, and it's important that your non-clinical team and your clinical team understands this to offer patient-centric care.
Okay, so do you want to just share an example of how you have successfully managed your facility?
For example, we use different things. So first and foremost, in my facility, we leverage a lot in technology.
Okay.
And so from your booking or appointment is online. So the patients, you don't just give the patients, if you go to regular hospitals, they'll give you a card and they're giving you the date and time that the doctor is available.
Sure.
In our facility, that's not what happens. We give you a booking link and then you pick whatever date and time that's suitable for you.
Okay.
Okay. And then you can now book that's how one of many ways we leverage on technology.
Okay.
Also, we take feedback. So once you leave our clinic, you get a link, that assesses every point of care that you assess throughout your stay in the clinic.
Okay.
And then what we also do is, so I'll give you a practical example. We had a patient who was going through fertility treatments, and she was having issues with her. So they've been married she married quite late, but I think they've been married for about 5-6 years, and they've not been able to achieve conception. And she, there was a lot of tension in the home. So granted, the man came in because fertility treatment is for both husband and wife.
Sure.
Came in, but there was still a lot of back and forth, and she would call me and she would lament. I'm like, patient-centered care. So what did we do for her? We got her to have a session with a psychotherapist, her and her husband. So that also helped, and she did. And to be honest, she did undergo an IVF cycle, and she got pregnant in her first cycle, which is a rarity given her age and all other comorbidities that she had. So it's very important for the overall outcome of your patients.
Okay, that's really nice, though. Because when the patients are involved, like I said, the outcome is usually
more favorable.
Better. So now you have talked about your own experience. So how about the healthcare staff? How do they embrace this patient-centered care?
So training.
Because you as the facility manager, you have your ideas. You know what you want to do.
Yeah.
But what if they don't want to buy into your own idea? Then it can be very frustrating, So you need to, are you able to ensure that they key into this idea?
First things first, lead by example. So a lot of times when they encounter difficult clients, they come to me, Dr. Chibuki, how do I handle this? They always listen to you. I said, they don't always listen to me. It's skill. Do you understand? The patient, a patient is upset about something and you're not listening to the patient and you're just telling the patient, I'm sorry, I apologize. The patient is even going to get more riled up.
Yeah.
So you must first listen. So what I do is lead by example. I first listen to your complaints. There must be complaints when you're offering service, when you're a service provider.
Sure.
You will get complaints, no matter how well you have tried to give the best care. So the first thing you do is listen.
Okay.
Then you take responsibility.
Okay.
In fact, my people, I always tell them, I didn't go and leak sugar. I'm just able to relate to the patient, relate to the client. I make them feel heard. I make them know the complaints that they've done, that they've laid is being worked on. And when eventually is worked on, I call back and I give a feedback. So as per your complaints, this is what we've been able to do to fix the issue.
Sure.
And sometimes there's a miscommunication. There might really be no issue. But remember, there is a presentation.
Yeah.
How that matter was handled. You see them at that point, they'll be like, oh, okay, I now understand why this is important. So first is leading by example. Secondly is training and retraining. Thirdly, what you want to do in a patient-centered care is create a standard protocol that people follow, staff follow, right? When there's no rule, there's no offense.
Okay, when there's no rule, there's no offense. Just hold it there because it's getting very interesting. We need to keep a date with the physicians. We want to ask people out there, our audience, have you been to a hospital before and were treated in a manner that you didn't like? Have you been able to communicate properly with your doctor? Has the doctor actually related well with you? Or you just say your complaints, even without, at the end, without even bringing out your complaints, the doctor is already prescribing. What kind of experience have you had in the past? Let's hear from you. We'll be back after the short break. Stay tuned.
Hospital care. Me and hospital no be friend. I know they go.
Yeah.
Let me just think about where my wife want to give birth. The way they are treating me, no, it's not good. That's why if I sick or anything, I have a headache, I don't like to go to hospital. I'll just buy the drugs and use, or find something else to use.
Some of them they go tend those people where they already pay them. Some of them they will just leave you outside. But they go attend another people where they pay money pass. So those people where they sick where say they know they attend them. Some people they treat you safe, they know sabi. They do or thing where they do. Yeah, to the sick go very serious before they go attend you.
The doctor doesn't even attend. It's only nurse that you'll be seeing. Before doctor will attend to you, you beg. Or else, if you have money to bribe them or something like that, to give them, so okay, come and attend to you. So that is the issue.
I'm hungry, but because you go attend to another people, cause I can't I can't explain that.
Every day and in every way. Enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you have just joined us, you're on to your regular health TV talk show, The Physicians, where your health is our business, and we say will always be our business. We've been discussing how to maintain patient-centric health facility. And in the studio with me is Dr. Chibuki Aigbe. She is actually the practice manager at One Wellness Center. She's been telling us a whole lot that we need to know. Not only just doctors, even patients. It's like knowing your rights in a health facility. When you're not satisfied, what do? Do you just go home angry and go to another hospital? You have a right to know what is going on with you, and you have a right to be part of your treatment. So, Dr. Chibuki, well done for all you have been saying. And before we went on break, sorry, you just talked about your experience with patients, okay? How you've been able to manage the facility. Now let's talk about how the staff have been able to cope with it. So how do you balance the care with operational efficiency and financial sustainability? How do you balance it?
So whether we like it or not, healthcare is a business and must be profitable. So you don't open shop to just do Sarah or charity, right? So you must make business, but at the same time satisfy your customers or your patients. Technology is a very huge part. There must be an active feedback mechanism, okay? And what you need to do is if you leverage on technology well enough, you create space and time to service more clients.
Very true.
So what you need to do is you can leverage technology to even have, if your patients are unable to come in physically, you want to give them an option to do virtual consultations. Once you finish, you send a patient summary. And most times, what is most efficient is having patient portals, right? So patients don't always have to be calling you, can I have my medical report? What medication am I supposed to take? When is it? So in your patient portal, the patients can see, summary of what the consultation is like, the prescription, their test investigations, and all of that. So technology plays a very huge role in that. Setting up realistic targets, financial targets, would also help you, okay? Because you don't want to start, giving inundating tasks, targets that can't be met. So it's important that that is considered. And then your patients, in your healthcare is one of the places that you don't really need to do spend so much on marketing. Your patients will do your marketing.
Yeah,
for you.
if you do well.
If you do well,
yeah,
exactly. And
that is how it is. Yeah, it's a double-edged sword. So if you don't do very well,
they
the
will
news
also
will spread
run you
faster.
down.
Yeah.
Exactly. So it's important. That's even the more reason we are advocating and preaching for patient-centered care. If I go to a facility and I feel I'm part of the management and my suggestions are being taken, and I would always tell another person, don't go to hospital A, come to the bright side, come and see what good healthcare feels like.
So from all you have said, it's obvious and it's important to, I want to recommend that most of the health facilities should actually have managers that will be able to put others through, so that when there's a gap, you do something. It's almost like in government when you have the cervicum. It's something like that. So when there's a challenge, they go and report, go to the cervical center and report or make inquiries. But now that you have said that, so how do you ensure patient confidentiality?
So what I do in my clinic, right? In your registration form, which is online, we always talk about leveraging on technology. Everybody has their phone, so you come on your phone and you do your registration online, and in there you give permission to you give permission on the form to the clinic to release information to A or B.
So you can share.
And you can also choose not to. So there must be a written consent, whether to share information or not. And also the staff you don't want we've seen now in the advent of social media, a lot of patients gist are always outside.
Yeah, true.
And that's because staff don't understand the gravity of patients' medical information, leaking leaking patients' information, and so they need to understand. So like I said, training and retraining, you can't do too much of that.
Okay, so I won't allow you go because our time is almost up. I won't allow you leave without you speaking to this particular point. How do you handle challenging situations when patients express dissatisfaction? You gave an example much earlier, so I wanted to break it down. How do you, from step A, B, and C, how do you manage such?
Listen. Okay. First, listen. 2, document. So you must document your
documentation is very important.
It's very important.
Even to doctors.
Yes.
Now with legal cases.
Yes.
Oh my goodness.
So you must document that you communicated and communicate that you documented, so that there are no ambiguities. Those 2 must be done. Okay. And then, so when you listen, you communicate, you document, and then you cry for help. Okay. So some issues will require multidisciplinary care. You make reference to the lab, you make reference to the medical director, you make the reference to even the front desk, and other specialties in the clinic to make sure that patient's case is resolved.
Thank you very much, Dr. Chibuki, for coming on our program. We really appreciate you. Come rest assured I will call you again to come and give us more the other things that have actually come up in your facility. And to our viewers out there, I just want to say thank you for keeping a date with us on your regular health TV talk show, The Physicians, where your health is our business. You've heard from our guests here talking about patient-centric health facility. When you go to the hospital, ensure that you're carried along. Be part of management of your own situation, because when you're part of the treatment, the outcome is better. Remember to follow us on our social media platform, on Instagram, on Facebook, on X. And of course, if you want to be part of this program like Dr. Chibuki, please go to our website. You have a form, just send us an email because they're just a click away. We have over 250 episodes in our YouTube platform. You can decide to binge on them so that you can give us some feedback. Till next week, my name remains Dr. Martina Aigbe. Stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body,
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.